remember seeing that scene or seeing that picture, and I figured that would be a very powerful metaphor for radiation, because you're lying on a table, you're being blasted with radiation. And it sort of felt like that, and I pretended I could stand it if I would think I was on the beach. You know, imagine I would go to this island, St. Simon's Island, and I take pictures there. We go there in the winter and sometimes in the summer. And so that was the first scene that came to mind. And then I figured I could build on that. And so, not knowing where it was going to go, and exactly, you know, sort of, but it was sort of an evolutionary process. So I figured I would want to know where the thing would begin, because I already know what it began with, which was the diagnosis. So I said I need to have a marker for a diagnosis so I can sort of build this story. It did remind me in a way of what I felt like on the operating table. You're looking at a light, it's above you, and it's sort of like you're going under, so it's like the whole thing is kind of like a little, you get woozy before you go out, you're counting backwards, they ask you to. And I looked at it and I was pretty peaceful. I was very confident in my surgeon.
We say that we have the multidisciplinary approach when we treat patients, and I think there is a missing component maybe in this, because we have medical oncologists, we give chemotherapy, we have radiation oncologists, we have surgeons, but those are kind of the medical modalities. But I think as you treat the patient, you have to have a holistic approach.
It's pretty much accurate portrayal of what I went through, because I mean, it's most powerful, as I said, with radiation was the most difficult part for me. So, you know, it was almost with my interpretation of radiation, for me anyway, and what I looked at with the pain, it was like, it's the end of the world, there's really nothing left, you know, but you have to keep pushing through it because there's something at the end of the horizon. That's what I got from it, because it was a very difficult time for me, and almost kind of make it break it type of thing, because there was a point where I was going to stop treatment, and me being 53 years old, you know, I was, you know, doctors told me just go a little bit further with it, and sure enough, they were absolutely correct, because on the other end of it, I'm feeling much more like myself.
I mean, it was just simply physically, you know, between the nausea and all the things related to cancer treatment, I was not able to pay.
How does it feel for you to have these paintings about your experience in the hospital where you went through this experience?
It's like, how to describe?
When I have a patient right now, either if they're about to be treated, undergoing the treatment, it can be difficult. Obviously, those patients have side effects. I sent them here and I said, listen, please take advantage, take a look, and maybe you do agree or maybe disagree what you see, maybe your feelings are different, but you should take a look. And I think what I like about this, because not only it shows you the sequence of the treatments, but at the end, as you see, there is a waiting, but there is hope. And I think there is always hope. And for cancer patients, I think this is very, very important.